Dr. Nick, I was so shocked to learn that prostate cancer is the most common cancer in Australia.
Yeah, it's true, Jack, because around about 50 Australians are diagnosed every single day. And it's often said that if we men lived long enough, we'd all eventually develop prostate cancer. So it's a pretty dodgy old gland.
And is prostate cancer like breast cancer and bowel cancer where you really need to detect it early?
Well, you'd be surprised how complicated that question is, Jack. But short answer, yes, early detection is better. And then, of course, the other weapon we have in the fight against any cancer is treatment.
Well, there is a new drug that's available on the Australian market, and that's led to calls for it to be cheaper and more readily available to those who need it.
So prostate cancer, unfortunately, is a very common cancer. In Australia, 50 patients are diagnosed with prostate cancer every day. And sadly, every year, approximately 3,500 die from prostate cancer. When a cancer is metastasised, it means that it's spread. So in the case of the prostate, it means that it's spread beyond the prostate to lymph glands or bones or other organs. So that's very important because if it's contained to the prostate or the pelvis, it can be treated with surgery and or radiation and in many cases cured. However, when it's metastasised, we need to use drug treatment in order to improve outcomes for patients with prostate cancer. Until recently, the treatment for metastatic prostate cancer was to use testosterone suppression alone in the form of injections every 3 to 6 months. These injections lower testosterone, which feeds the cancer, and they're very helpful in treating the cancer. However, in a recent breakthrough, we've seen the addition of darolutamide, a hormonal drug, in addition to intravenous chemotherapy called docetaxel, significantly improves outcomes for patients with metastatic prostate cancer. So even though there's testosterone suppression is being used, there's still some testosterone made by the body and by the cancer cells themselves, and the darolutamide helps to block the effects of that. So it really works very nicely in conjunction with the injections. We also know that the chemotherapy is important in further improving outcomes. So it's really that triple therapy combination that's proven to be very effective for some patients with metastatic prostate cancer. So in terms of access to darolutamide, pleasingly it was recently approved by the TGA, and we look forward to it being available on the pharmaceutical benefits scheme so that it can be accessed by more patients with metastatic prostate cancer. This breakthrough is a big deal for us. We all want to see our patients living longer and living better. We really want to turn this condition into something which is not a terminal diagnosis, but really a chronic condition or disease that patients can live with for many years and have good quality of life during that time as well.
Some great hope, Joe, for the more than 200,000 Australians currently living with prostate cancer.